Hi, my name is Dr. Kristen Batla, Chief Medical Officer at On Duty Health. Today, we're going to be reviewing the NFPA's update to the 1582 standard regarding aerobic capacity. We toss around these terms, METs, VO2. So first, let's talk about what a MET score is. METs is an acronym that stands for the metabolic equivalent of a task. And that refers to how much energy it takes to perform a task. If I'm just sitting at rest, that's about 1 MET of energy. If I'm hiking up 8 flights of stairs, then that's 8 METs, 8 times the amount of energy that I would use at rest. Previously, these MET scores that the NFPA recommended our firefighters achieve were not age or gender specific. Naturally, as firefighters progress in their career, their scores would decline, but we would still encourage them to achieve a MET score of 12. That is now changed. Additionally, we are also now factoring in gender to the equation. The scores that will be the same are the scores that are required for a new hire versus an incumbent. So that means anybody coming in versus somebody that's been on the job, their scores are still going to be the same, held to the same standard. However, the person that's the incumbent will fall into a later age category likely. Since we're going to be talking in terms of percentiles, I threw in here a bell curve so we could refresh our memory of what a percentile means. Right down the middle of this bell curve is a line that is the 50th percentile or the median. Our hope is that all firefighters achieve a MET score of greater than 50%. This is what the NFPA is saying is the new standard. Anything below 35 percentile is where we are needing to potentially look at job restrictions. This table here is pulled straight from the 1582's update. There's 2 sections. The upper section, part A, is for people testing on treadmill. The lower section is for people testing on a cycle ergonometer or a stationary bike. This is nice to have these new numbers that are stratified based on method of testing because we know that people that are on a bike are going to have lower VO2 scores, not necessarily because their aerobic capacity is lower, just because of the testing instrument. So for an individual that is of 20 to 29 years of age, so these are our new hires, we're going to recommend that the males test to a point of 13.7 or a female to 10.7 METs. So this is a little bit higher for the 20 to 29-year-old males, but you'll notice that it's also lower for the females because before we were asking those same females to get to 12. And so these are where we're seeing some of the changes. This next table has the people that are going to fall in the lower than 35th percentile. You can kind of think of these percentiles replacing the previous metrics of 12 METs. So 50th percentile would be where the 12 METs used to be. 35th percentile would be where the 8 used to be. So any individual that is less than or below the 35th percentile should be considered to have a restriction from particular essential job tasks and participate in a cardiorespiratory fitness program. Zooming in here on exactly what that means, let's throw around some examples. So let's say that you have a new hire coming in. He's 22 years old. He gets on the treadmill and he scores 12.0 METs. We used to say, fantastic, that's where you need to be at. Now, because we're going based on percentiles, that number is actually 12.4, so a little bit higher. However, if the new candidate is a female, then the goal there was 9.6, and that individual has met that threshold. And again, just to reiterate, a lot of this verbiage on this slide that's translating into the next or the current edition of the 1582 talks about, does there need to be an intervention? Does this person need to be put on a prescribed fitness program? And the same verbiage is used now. So anybody that is Greater than the 50th percentile, no intervention. Somebody that is between the 50th and 35th percentile, no restriction. They can do the job, but they need to be on a fitness program. Any individual that is below the 35th percentile needs to be on a fitness program, and there will potentially be a recommendation for a restriction from certain job functions. This is another way to view those two tables. These are the scores solely for the treadmill. So if that's easier just to have it in that view, you can copy and paste from here. That's from the IAFF's handout on this topic. And then lastly, we reached out to the National Wildfire Coordinating Group to ask about the individuals that use our aerobic capacity testing for red card status and what was going to change, if anything, now that the NFPA had adjusted for age and gender. The coordinating group basically said that the wildfire medical standards will not change and that the work capacity test still has to be at 12 METs. So that means if you have a new hire female that only needed to score 9.6 because she was between 20 and 29, still wants a red card, then they need to test to that point of 12 METs to also get their red card. I'm sure departments will have questions. That's what we're here for. Please reach out either by email or phone. We're happy to help walk you through this new update as well as adjust any SOPs that your department might have. Have a good day.